So as our first question, would you please state your name and your profession?
My name is Delanor Manson, and I am a nurse. I'm also the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition.
What are some of the reasons you are drawn to in a career in healthcare?
You're probably going to think this is a very unusual answer. I really wasn't drawn to a career in healthcare. I went to nursing school under duress. My grandmother really wanted me to be a nurse. I really wanted to be an attorney. And after she died, I decided that I could go to nursing school. I can go to law school anytime. During my first clinical rotations, I went to the University of Kentucky. I saw nurses who were doing what I consider to be incredible things, and how they talked to the patients, how they took care of their families. And I thought, wow, they are exceptional. I'm not sure that I'll ever be able to do what they're doing. But I also continued to watch, and I didn't see anybody caring for them. I saw them working the long hours, doing the impossible things, but no one really caring for them. And so I decided that I could be a person who could care for nurses. I could be a person who could lead them and provide them support. And so I made a decision to finish nursing school, but my contribution to healthcare was going to be taking care of the nurses. And so that's what I've done throughout my career is to take care of nurses. That's what I do.
And so with that career and taking care of nurses, what is the most rewarding part about working with the Kentucky Nurses Association, everything that's involved with your job?
Well, there are about 90,000 nurses in the state of Kentucky. Most people are unaware that we are the largest healthcare profession in the state. In fact, we're the largest healthcare profession in the United States and the world. But the most rewarding part is being able to say yes and to help them to accomplish any project that they want to work on for their community or for the public health department, or to help them to figure out how they can volunteer and complete an activity for their community. The greatest part of my job is being the support and the foundation for what nurses need and want to do for their community.
And so with that role of support for the nurses in our community, the many nurses in Kentucky, how has the pandemic affected your work? And what have you and the Kentucky Nurses Association done to assist nurses during this time?
Oh my gosh, you said we only have 30 minutes? All right, so, wow. The pandemic has provided me the opportunity to support communities of nurses as they work with their health departments, to support the nursing schools to find rotations of clinical activities so that nursing students can build on their clinical knowledge. Many of the hospitals and other places that nurses would go for training are not allowing them to come because of the pandemic. And so I've been able to work with nursing schools to be able to help find them rotation places, including at LouVax and at our testing clinics, which is what I was doing today when I couldn't meet with you. So, and then also to bring a lot of retired nurses out to the clinical settings to help us get the vaccines out. So my job has expanded, I should say. And I do my other jobs for those three organizations after the clinics have closed. And the other times I am coordinating activities for nursing students and nurses, volunteers, so that we can get out there, give the vaccines and do the testing. So my job is broadened, you might say.
Well, it sounds like absolutely great work. And so something you've written and talked extensively about is the racial disparity in healthcare treatment and access in our society and our community. And so what are some of these underlying issues that must be addressed in order to help close this gap?
Well, I want to say that the pandemic has basically pulled the covers off of a major problem for healthcare, and that is the disparities in outcomes for non-Caucasian people, disparities in access to care. And so the question begs, you know, when people ask me, when do you think we're going to get back to normal? And it's a hard question to answer because for a lot of people, non-white people, getting back to normal isn't very healthy. Getting back to normal for those people means still lack of access to healthcare. Still, it means that when they go to be involved in the healthcare system, that they may not get the treatment that they need to address what they went to address in the healthcare system. So I don't really want to get back to normal for those people. I want to get back to something where they get better than what they got before. So what do we need to address to resolve healthcare disparities? Well, some of the things we need to address are implicit bias and the trust issue for non-white people of the healthcare system. And that's not going to be an easy solution. The trust has to be earned because I'm not sure if you know, but I'm a retired naval officer. I served my country for 27 years. And so I am a patriot, but I'm also a realist. And I can tell you that my father, who is 88 years old, would probably be dead now if I were not in his life as a healthcare provider. Because his physician basically said that his prostate cancer was really going to be slow growing and there was really nothing we really needed to do about that. Well, my father's history is that his father died at 103. This diagnosis was for my father when he was in his 70s. And I didn't believe that we should just do nothing. So we got a second opinion. And then the second opinion basically says we need to treat this aggressively because this is a person who's going to live a long life if we just give him the tools to do that. But my father's case is an example of how older Black people are treated many times in the healthcare system. This physician didn't value my father. He didn't even think about a second opinion. He basically said, oh, it's slow growing. There's really not anything we need to do about it. So how many other people like my father will hear that from that particular physician? And he may not even be aware of his biases that made him make that recommendation. And so the question I would ask is that the same recommendation he would have made if my father had been a Caucasian? And I would say probably not, considering how fast growing the cancer was. Probably not. So we have to earn the trust, and we start by looking inward to see what type of biases do we have that are not allowing us to make the right recommendations for the people who are in our care. So I would say that the first thing that we need to do in healthcare is to address implicit bias. In terms of other social determinants of health, if we address our implicit bias in healthcare and we address implicit bias in other professions like our educators and our judicial system and all of those areas where people are making major decisions about the life and care of non-Caucasian people, then I think we would see non-Caucasian people in a different light. And therefore, maybe we would really get focused on the fact that there are no healthcare, access to healthcare clinics in communities of color, or grocery stores where fresh fruits and vegetables can be purchased in communities of color, or restaurants that provide healthy food so there can be a selection for people of color, or places where they can work out or walk that are safe in communities of color. So we have opportunities when we can't do it all at once. So we have to sit and talk about what things should we work on first with the communities of color. And that's the other thing. And that is not for people who live outside the community to make the decisions about what should be happening in the community because they know best. That's a very paternalistic attitude. But to talk to the people who live in the community who are experiencing these issues and say, where should we start? What can we help you do to address these issues?
And so you have talked before about how to address this implicit bias in healthcare. And so, and you've also talked about anti-bias education for nurses as well. So what are some of those opportunities that you've been working on? What has Kentucky Nurses Association been doing in order to further that idea?
Oh, I am so glad you asked. In April, the Kentucky Nurses Association, we penned a op-ed with a 5-point plan of what we must do in order to address implicit bias and disparities in healthcare. And part of that plan included assessing where the nursing schools are in providing education, addressing implicit bias, and cultural humility. But before we can get to the nursing schools, and we have developed a survey that we're going to be deploying probably in the next 30 days, is to look at what do nurses need today that they didn't get in nursing school. And that would be implicit bias training. And so we're working with the Kentucky Board of Nursing to consider a continuing education requirement for every nurse on as a licensure requirement on implicit bias, because every nurse has the opportunity to impact the health of others. And we need to be aware of our own implicit bias. And one of the things that I like to have in the communications sphere is that everybody has implicit bias. I don't care who they are. And we are all victims of our implicit bias, especially if we are unaware of it. If we are aware of it, then we may make different decisions, or we might ask a different question. Something like, am I not suggesting that this person get a second opinion because of my views of African Americans and African American men? That should have been a question that that physician should have asked in relation to my father's kid. Oh, I have other things we're doing. Let me tell you about more. I'm sorry. Okay, I have a whole list. So the survey is one. The CE credits for a licensure is another. Those two kind of go together. We're also doing movie nights that we're doing monthly. It's called The Intersection of Social Justice and Healthcare. It's a 6-part series. We did our first one in January, and it was called The Power to Heal. And we had a panel discussion related to the movie, and we had about 3,000 people to sign up for the class. So that was pretty impressive and unexpected. But this one that we're doing in February is called Incarcerating Us. And we'll have a panel discussion with a judge, a legislator who's also an attorney, a nurse who is an attorney, and she did her dissertation on prison systems and healthcare. And hopefully we will have another nurse who is a person who was a head nurse at a prison system, and he is now a professor at EKU. So another thing that we're doing is we penned a resolution about our commitment as an organization to social justice and how we can help organizations assess their hiring practices, their promotion practices, their retention practices, and to look at diversity, equity, and inclusion. So we have a plan, and we are busy moving forward with our plan.
Well, I'm definitely glad to hear it. Sounds like you have a few things on your plate to keep it going.
Absolutely. Absolutely. We're also looking at the leadership of the Kentucky Nurses Association. We have been an organization for 115 years this year, and we need to make sure that we diversify our leadership by geography, by ethnicity, um, even by gender, because most of the leaders in the Kentucky Nurses Association are women. Men are nurses as well. We need to diversify and listen and learn from people who are different than the majority of the nurses in Kentucky.
And so, what are you currently working on that you are most excited about? And how do you think that it will drive improvements in healthcare and health in general in Kentucky?
Well, I think that the things that we're working on related to implicit bias and the education and working with the schools is one of our top priority activities. Realizing that nurses have a responsibility to advocate, innovate, and educate, and taking a stand and moving that forward. And bringing along the nursing students. I mean, they are our future, and making sure that they have opportunities to participate in the things that we're learning from the pandemic. I think we also have to think about what things have we learned from the pandemic that we will continue to do. Things like telehealth for those people who cannot get to a physician or a nurse practitioner. Things like what type of testing do we need to do that will meet the needs of the communities? And then how do we work with communities of color so that we are meeting their needs, not the needs that we have, that we want to say we helped. Well, we want them to say, we had a need and you helped us, versus we saw what we thought you need and we helped you. So I think that when I think about what KNA is working on and the differences that I think it's going to make to healthcare moving forward, it definitely is in working on disparities in health and working on implicit bias as a way to address those disparities in health. The other thing is, and you haven't asked me about this, but I think that we as healthcare providers must collect data on the populations that we serve. And that data should include their race and ethnicity and their health condition, how they are getting treated, and what the outcomes are, so that we can compare how we're treating people who are not in the same ethnic group. So that we can say, well, yes, we prescribed this medication for this person, but we didn't prescribe it for this person. Why is that? They have the same disease process going on. And we need to look at that. We need to do the research to find out why that is happening. Right now, when someone says, I think that I was treated differently because of the color of my skin, we have very little data to actually point to say that that is exactly what happened. So that data collection, that research must occur so that we can quantify that and then do something about it.
And so, moving forward, how do you think that Louisville and the state of Kentucky are doing in their response to the pandemic? And what do you think are our next steps?
Well, I think we're doing a great job in Kentucky. First of all, in Louisville, the LouVax at Broadbent is phenomenal. I don't know if you had an opportunity to go out there or to see some of the pictures, but a drone, one of our camera-ready drones, took a picture of, well, actually, they took a video of the cars coming into LouVax. And when you're watching this video, it reminds you of a ballet, because the cars come in and then they're funneled in and then they go out to different lanes. I mean, it's just like a ballet. We've had people from all over the country to call and say, how did you all do that? Can you help us do that too? I mean, there was an article in the Wall Street Journal. I mean, people are noticing how we're doing things in Kentucky. And the important thing about Louisville, it's not that it's Louisville, but that it's a microcosm for the United States in terms of our demographics and the things that make the country special, unique. So we have that demographic in Louisville. So I think that the Kentucky Nurses Association throughout the state, they're working with other health departments to provide vaccinations and to do the testing. And I think we're doing very well. Our limitations, basically, we need more vaccine and we need to do more testing because our testing is down about 30%. And the testing the testing is very important to find out who is infected so that they can quarantine and not be in public and sharing the virus. So I think we're doing very well. I'm very proud, very, very proud.
And am I correct in saying that you also help to, and the whole Kentucky Nurses Association with its members and its friends also help to deliver 1,000 apricot ribbons and 1,100 face coverings or face shields as well?
That'll be 2,100 face shields.
Oh, okay.
2,100. Yeah. Well, the Speed School in Louisville, they built, they made the first 1,000, and they would call us and say, we have 400 ready for you, and they would put these little notes inside the bags because what they made the shields, and then we had to purchase the straps and put the instructions on how to clean them so that they could reuse them. And they would send, every bag had a note from a student thanking the Kentucky Nurses Association for helping. Yes, we did those things. And the 14,000 bottles of hand sanitizer. Now that was very interesting because the distillers around the state donated 340 gallons of hand sanitizer, right? And we had deans from nursing schools all over the state. They would get in their cars and vans, and they would drive these barrels of hand sanitizer from the distillers to KNA. And then Pizza Hut, which is across the hall from us, would let us use their downstairs lab. And then Southeast Christian Church allowed us to use their communion cup filler, where they fill the communion cups on Sunday. They have this huge machine, and it has 40 little tubes. So I went to pick it up, and we took it down to the Pizza Hut place. We filled it with hand sanitizer. We stuck the 40 bottles under, filled them up. Somebody else put the labels on it. We stuck it, and we did that until we couldn't do it anymore. But we had volunteers from everywhere to come and help us fill the bottles, label the bottles, seal the bottles, package them up, and drive them out into Kentucky. Yes, we did that.
Well, it's amazing to hear so many people coming together to distribute thousands of hand sanitizers, because I think that we all remember when you could barely find a single bottle of hand sanitizer in any store you looked at.
Couldn't find any. Yeah.
And so going away from what specifically Kentucky Nurses Association is doing and the affiliated organizations working with you, what are some ways that the community itself can support nurses and other healthcare workers?
Oh, gosh, another great question. I tell you, you really did come up with some good questions. So one of the first things you can do to support nurses is to wear face masks. And I'm being very sincere, because if you can prevent spread, then maybe someone won't get sick and end up in the hospital and be a person that a nurse has to take care of. And I like the way that you brought in other healthcare workers as well, because nurses are exceptional collaborators with other people in the healthcare profession. Things like just thanking a nurse, washing your hands, social distancing, and staying home. And I know that's hard. because we want to be social. We want to be in communication. But I tell you, there are lots of people who said that they're tired of Zoom and they're tired of video chats. But, you know, it certainly beats nothing. And it also is very safe. And so if we can only be in proximity with people when we have to, then that'll help support a nurse. We also did a sign campaign. It said, "Thank you, nurses," and then we listed other healthcare providers. And we made 500 of them, and we took one to every hospital around the state and to many of the nursing homes. And we stuck them in the yard. It basically says, "Thank you, nurses," because nurses are getting tired. They're working 24/7, and they're working 7 days a week, and they're tired. So just having somebody to say thank you really goes a long way. It goes a real long way.
And so to finish up our interview today, is there anything else that you would like to address that hasn't already been said?
Yes, there are two things that I would like to bring forward. One is we must encourage our communities to get the vaccination when it is their time. And if they are curious or they're not sure if they should get the vaccination, then I would say reach out and ask the questions, and but ask the questions. Testing, I want to encourage our communities to continue to test until we beat this pandemic. And also back to the vaccinations, to get the vaccinations as soon as you can so that we can not have the variants to come into our community. And the way to do that is to make sure that people are getting vaccinated so that we can stop the spread of the virus.
Well, thank you so much for giving some of your time today. It's been a great time talking to you. It's been a pleasure, really. And all of your work has been extremely inspiring. So I thank you. And I wish you luck in all of your further pursuits and the further pursuits of the Kentucky Nurses Association.
Thank you for inviting me.